Welcome to the Acupressure for Labor and Childbirth online workshop. My name is Dr. Emilie Solomons. I work at AcuBalance Wellness Center in Vancouver, Canada. I became a doula in 2005 and have been practicing as a doctor of Chinese medicine and an acupuncturist for 14 years, helping people get pregnant, stay pregnant, and have healthy childbirths and postpartum periods. This is one video of a 4-part series. I also have a prenatal massage, diet, and lifestyle video, an early pregnancy video, and a postpartum care video. So if you haven't seen those, take a look. There will be more in the series if you're interested. For this video, I will be teaching acupressure for labor. Ideally, you'll be watching this as a pregnant person with the person who is going to be at your labor. This could be a partner. This could be a doula, this could be a family member, and it's really nice to be able to watch it together so that you guys can practice together. So this is something that you can actively do at home to help prepare for the birth, as well as throughout your labor, whether it's in the hospital or from the safety of your home while in quarantine or self-imposed self-isolation. I know a lot of people are feeling a bit of stress because they are unable to go to their acupuncture appointments, go to their chiropractics or massage. So I really wanted to make sure that I created a video so that people can still do things at home and feel like they are actively making a difference to have a really positive birth experience. Acupressure can be used from 37 weeks onwards to encourage beneficial hormonal responses for labor preparation and encourage the baby to move into an optimal position. Recent research report reduced epidurals and cesarean sections when acupressure is used in labor. And for those of you who love research, if you click on the link and go to the AcuBalance Wellness Center page, we have added the research as well as handouts with pictures and the full acupressure booklet, which was created by Deborah Betts. Now, I love acupuncture. Makes sense, it's my job. But the wonderful thing about acupressure is that it can be essentially done by anyone, anywhere. So it can be in the water, in the bed, in the hospital, on a birthing ball. Acupressure can be done early, often, and it's free. And this is so important right now, all of those things. There are more specific points that can be suggested by a practitioner with proper diagnosis, assessment, but what I'm going to teach you today are some basic points that can have a big impact on the birthing experience and outcome. So let's get started. The key with acupressure is that you're applying firm pressure. So this is not, nobody in labor wants light, kind of like unsure touch. Frankly, it's annoying and you're probably going to get barked at to stop and go away. The thing with labor is you want kind of confident, firm pressure, and it can really help alleviate pain, help with contractions, help with the position of the baby. So what I'm going to do is I'm going to teach you a few little protocols that you can do depending on what's going on. So what I would like you guys to do, whoever's watching this, is I'll teach the points and then you can actually practice these points every night. So each point for 1 or 2 minutes so that you're getting comfortable with the location of the points as well as the level of pressure, because every person likes a different level of pressure. And I often get when partners are together, maybe they're pressing way too hard or too light. And now before the labor has started is the best time to actually be giving that feedback, because once the person is in labor, that's not the time to do coaching. It's not the time to be teaching, because that gets the person into their head and not in their body. And what we want in the birthing process is people to be in their body and not like trying to find a way to figure out if a point's comfortable. So do practice this at night if you can for a minute or two each point, so that by the time the birth starts happening, you will not feel overwhelmed, you'll not feel confused about what you guys are doing. During the labor with acupressure, instead of doing it 1 or 2 minutes each point, what you will be doing is you'll be applying the pressure to each point for the duration of the contraction. So for those of you, a contraction or birthing wave, it actually happens a bit like a wave in the ocean. So the sensation will start, and then it'll ease up, and it'll peak in its intensity, and then it'll come back down. And so what you're going to want to do together is that as soon as the person who's pregnant gets the sensation like, oh, it's starting, they'd say, oh, okay, it's starting. The person's going to gently ease in with pressure. So we don't want any quick movements, but like a gentle ease in pressure, then hold for the duration of the birthing wave or contraction. And then it's, maybe up to a minute. So you're going to need some strong thumbs. And then once that sensation is done, you're going to ease off it. So we're easing in and we're easing out. Now, not all points are going to feel great in labor. Certain ones will feel amazing. And you'll know that, it's a good point for them because they're not just going to say, oh, that felt really nice. They're going to say, don't take your thumbs off there. So then you'll get the positive feedback. Other points are going to have a really good use in them, but they don't feel quite as feel good. They're less for the pain management and more for an efficacy in like improving the contractions or improving the birthing waves. You may have to try different points as we go along, or as you go along in the birth, and they may change. So at one part early in the birth, certain ones are going to feel really good. And then as you go along, you're going to get feedback that certain points are now feeling better. The first combo I'm going to teach you is establishing contractions combo. Now, this is really good for things like prodromal labor. So that's when the sensations are kind of niggling. You're getting like a little bit of a contraction, but it's not really going anywhere. Or people who have it at night, they feel like, okay, the birth's starting. And then by the morning, it stopped again. So those ones, or if you're going from home and you're moving to the hospital, and at home, you were getting your sensations and they were coming regular and they're great. And then you got in the car and you drove to the hospital and everything stopped. This is really common because if you think about your body, it's in that safe place, it's having the baby, and suddenly you get in the car and you move and the body goes, oh, we're moving, not safe, shut it down. And then suddenly there's no more contractions or birthing sensations once you get to the hospital. For that, which is natural, you're going to want to do this combination, and anytime you want to kick up the birthing sensations or contractions in their frequency or in their intensity. So the first point I'm going to teach you is large intestine 4. There's 2 in this combination. So large intestine 4 is on your hand, and it's between the thumb and the index finger in the meaty piece here. And so like I said, if you go, we have the handouts that have pictures as well. But what you're going to do is, if you feel in there closer to the index finger, kind of digging in there, you're going to feel a really tender spot. So you see I'm kind of pinching both sides. And if you press hard, you kind of feel like almost like a bit of a nervy feeling. So that's a really good point. And what you're going to be doing as the partner or the support person is at this point, if the contractions are really far apart, you could do them during a contraction, maybe a few minutes later, and then during the next contraction. But as the contractions start to come closer together, you will do it for the duration of the contraction. You're going to hold the 2 points. And it's nice because you can also connect with the partner that way, because you're holding their hands and you can look at them and you can tell them, you got this, you're doing this in further stages. Or if it's early on, it's just, there's a nice connection to it. Okay, so a little switch. I now have my assistant because I am in self-isolation and quarantine. My assistant today is my child, my 7-year-old child, who is wonderfully pregnant with their baby and is very excited about this. So as you remember, I just talked about I'm talking about the combination for contractions, for increasing their frequency and the intensity of them. So the first one that I mentioned was the large intestine 4. So you're going to be doing both hands. A lot of times we would go like this. So as soon as the contraction started, you could press the 2 points. And then once it's off, then you're easing off again. And if you're just practicing because you've not started labor, then you would just hold them for a minute. The one that we go that is in combination with that one is called spleen 6. So I'm going to get you to lean back. Yep. So the key with this point is you're going to take the inner ankle, and the way we describe it is one hand breadth above the inner ankle. But as you can imagine, and this happens with a lot of partners, my hand and my child's hand are very different sizes. So in this case, when we talk about going above the inner ankle, we're talking about one hand of the person whose ankle you're using. So we're going to compare hands. If I compare my hand with them, is about 3 fingers. So what I'm going to do in this case is 3 fingers above, and we've got the tibia right here on the back part. So I go like that so you can see. It's going to be deep in there. So we have the tibia, the bone, and you're just going behind it in a nice little depression. So if we use my child's hand, we'll see that we're looking at 4 fingers, so one hand. So what you're going to do in this case during the contractions is maybe one contraction you would do the ones on the hands. The next one, you would take both the ones on the legs and you would press them. So one contraction, then the next one. If you are lucky enough to have 2 support people at your birth who are ready and willing, you could have one simultaneously touch the top and the other one hold the bottom. So that is the first protocol. The next one we have is for posterior or malposition. Now you're not always going to know that the baby's not in a great position, and I'm not talking about breech, but maybe posterior or just asynclitic where the baby's not exactly lined up the way it should. You don't have to wait until this has been officially diagnosed. Anytime you're noticing that the waves, the birthing sensations, the contractions, you feel them in your lower back mostly as opposed to the front, or that the birth is just not going anywhere, the baby's not coming down at all, you can safely assume that the baby's not perfectly positioned, and then you can do this combination. So with this one, I wonder, can you point your toe for me? There we go. Well, that might be hard. So what you're doing is you're taking the pinky toe and you're actually going to do it, and I'm going to use my hand so you can see. What you're going to be doing, let's go right up close, is you're going to be finding the bottom edge of the nail and the outer edge of the nail on the pinky toe, and you're going to be using your nail and just pressing it. And so what that's going to do is it's going to stimulate a point called bladder 67. And another thing you can use is you can use one of those click pens, click it off so we're not coloring on anyone, and you can actually use that and press against that. So you're using the pinky toe, the base of the nail, and the outside edge of the nail, kind of making 2 imaginary lines, and you're going to be just pressing in there. And so what this does is it helps draw the head into a correct position. This one you don't have to do with the contraction. Sometimes you can actually just hold it firmly for 5 minutes, 10 minutes, if you can. And that will help stimulate the baby to shift and to move into a better position. Now, if you've known earlier on, maybe 38 weeks, 39 weeks, that the baby is posterior, so that back to back, then you know at this point you can actually do that point as well with the stimulating with the acupressure. Next one that we have, it's going to be an interesting one to do on this. So, honey, can you look, go on your knees and face that way? Yeah, perfect, all the way straight. Okay, so now this is possibly the smallest laboring hips I've ever seen. But what you're going to be doing, this point is the acupressure point for back pain. And a lot of people will, whether they are having a back labor or posterior position, or just later on, once they're getting to further 7, 8, 9 centimeters, there can be strong sensations in the back. And this can be a point where often the women will say, don't take your thumbs or knuckles off this point. It feels too good. So the location of this point, it's called bladder 32. It's 1 finger above the top of the bum crease. Now again, my finger is not the same size as this person's finger, this laboring person. So we're going to compare. Now if I go, okay, so about to this knuckle is the size that I'm going to be using. So what I do is, I'm not going to show this on TV, I get in trouble, but I'm going to find the top of the bum crease, and I'm going to do one finger above and about a thumb's width on either side. And what you're looking for a technical term, is the second sacral foramen. So what that is you've got a triangular bone here that ends with your coccyx, and we're just trying to find the second hole. So if you do one finger above the bum crease, on either side, you're going to feel these little indents. And so what you can do with this is you can firmly press in with the sensation, and then you hold, and then once that sensation's off, you can ease off. If your thumbs are getting sore, sometimes putting your knuckles in can feel really good as well. So same thing, you're going in, you're holding, and then you're coming off. So those are really nice, and that can be used in conjunction too with the hip squeeze for people who have learned that in prenatal classes, where you take both hips and you're kind of doing an upward squeeze hold, and what that offers is a counter pressure, and it actually relieves a lot of the sensations of intensity that people have during their waves. So that's a great one to be using. Oh, see, the baby's already coming out. This is amazing. So we have 2 more protocols left. So the next one is I call it the transition or anxiety point combo. Now, a lot of people, when they are in transition, so that those last couple of centimeters before they start the pushing, the second stage, the pushing stage, can be very intense, and a lot of people can get to a point where they can feel really anxious or say, I can't do it. This is a great combination to really ground the person and get them in their body and ready to go to the next stage. This is also a point you could do anytime as you're practicing if you're feeling overwhelmed, if you're feeling anxious. You can use a rubber ball or a golf ball and do it yourself if you don't have someone to do this for you. So this is a really great combination for any kind of stress. It just calms and grounds. So what you're going to be doing, we have our foot here. If you imagine the toes aren't there, we're going to cut this foot into thirds. Right at the base of the ball here, in the center, is the point. So what you can do is you can press on this point firmly, or if you have a ball, you can actually step on the balls into this point. So again, thirds, 1, 2, 3, that top, sorry, I hope I'm not tickling your feet, firmly in there. A great one if you are someone who naturally feels very stressed and anxious, or say those of you who are still in quarantine and watching this, if that stress is bothering you, you can put your foot or your thumb on this point, or have someone put their thumb in that kidney 1 position, and then I'll get you to point. The other point, if you look at the 2 toes and you move up to where where the junction of the first and the second toe meet in their bones, you can actually, sorry, there we go. We're pinching. So I've got my thumb at the bottom, and then I have my finger in the top. I'm just kind of massaging. So that top point is called liver 3. And that one's really good for that feeling of like tight stress, teeth grinding. And so that combination, the bottom one is more like I'm feeling really anxious and I'm up here and I need to be grounded. The top point is more like, oh, I'm feeling very stressed. And so the combination is a really great combo for really calming. When I do these, I like to actually stay lower than the person who's having their baby, because also that causes a grounding effect as well, right? Too many times people are above the person laboring, and there's a power dynamic that's not great. So going on the bottom, you're going to be able to really ground the person. You're holding both of their feet and helping them. Oh my gosh, the baby's already been born. This next one's the last one, and I think the baby might be born, and our superstar here might get their big roll. So I'm going to lift this up a little bit. First thing, I'm going to get you to stand up and face the wall. All right. So this point, what you're looking for, can you look down at your belly? Oh, yeah, there we go. So you have C7, which is the biggest bump. Okay, now head back up. which is the biggest bump when you turn your head down. You take that bump and the end of the shoulder, you draw an imaginary line, and it's just on both ends. So halfway point between C7 and the end of the shoulder, so you can see that nice little bump on either side. Now this point feels really good. The purpose of this point is to help cause a descending action. This is great in the second stage when you're pushing the baby out, but it's also good at any time you want the baby to descend. So sometimes the baby's just floating up and we just need a little help with descending further into the pelvis. So I'll have you sit down. What you would do in this case is you're going to be, say the person's on a ball, okay, just sit up straight here. You're going to put your thumbs in and you're just going to push firmly down. And this point, they are going to love you for this one. So we can birth the baby now. Ready? We're going to do a nice big breathe and push, push. All right, here we go. Baby's coming out and to the chest. Good job. Awesome. All right, everybody. So there you have it. Our first video on acupressure points for the birthing period. Stay tuned for the rest of our videos and have a wonderful, safe, and positive birth experience.